Uh, I'm going to move along because there are a couple topics that I really want to try to get your thoughts on. The first is something that I've particularly dealt with all my career is just knowing about things that help aren't necessarily enough to get doctors to change the way they practice. And so there are over 900 neurologists in the Department of Veteran Affairs. But as you know, most headache is managed by primary care practitioners, and that's thousands and thousands of them throughout the VA with our advanced nurse practitioners and our physicians. And so Dr. Hoffman, you were sort of talking about this being, this, when I'm talking about neuromodulation now being well received by patients. What about your colleagues, your neurologists and primary care and other specialists that you deal with all the time? Are they open to this, or are there some resistance that you're seeing?
No, absolutely. I have a team of 10 neurologists now at Orlando VA, and we meet every Thursday, and we do have clinical discussions, and that are partly teaching, partly business. And at least once a month, I sample their views on the most common disorder that we treat, which is migraine. And all of them have had a very good experience. And I ask them, how well do you think it works? Oh, easily the majority. And no, none of them have disagreed. And we all have to, even though we all have subspecialties in neurology, we all have to do general neurology. So we all treat headaches together. So we are 10 of us, and we all treat headaches, and that's been our experience. Yeah.
So how about either Dr. Reese or Dr. Seco? Are you seeing other physicians be open to this, or are you seeing them generally more comfortable with the way that they were trained in classic headache management?
I can speak just from from at Walter Reed. I think the physicians generally are open. I think the fact that we don't have a lot of the insurance barriers, plays a big role where we're not working about prior authorizations and such. And I think generally most of the physicians treating the active duty population are trying to do any and everything possible that's out there to treat our patients, efficaciously and with good clinical evidence. I would say that some of the barriers become, and through access to these type of modalities, are a little bit of red tape and getting it funded, whether or not the system is on a FSS schedule, or do they have a DAPA agreement? And so these are the kind of things that kind of can slow this process up and getting this to our veterans and our active duty population. Once it's there and once they have that access, I think generally most are open to trying something, particularly that's minimally invasive and has very low side effect profile with good clinical evidence. I don't see why, and we have at least 12 fellowship trained pain providers in that facility that are all open to trying and aggressively trying to treat headaches. We work very closely with our neurology colleagues and behavioral health departments, and particularly under that NICO umbrella.